Alright, so our scenario is we are being dispatched to a university baseball field for an injured player. Upon arrival, we are escorted to the dugout where a player is sitting up, complaining of chest pain and shortness of breath. He was in the batter's box when he was struck in the left side of the chest with a 90-mile-an-hour fastball. Alright, so the first thing that we want to do is determine if the scene is safe. Once we have determined that the scene is safe, we want to wear the appropriate PPE when coming in contact with the patient. For that, I would suggest gloves. During this point in time in our world, a mask too would be adequate. Alright, after we do that, we want to determine the mechanism of injury. So the player was struck with a baseball on the left side of the chest. It is important to note that the heart is on the left side of the chest as well as the left lung. So we want to take note that there could be some possible heart damage as well as lung damage. There is one patient, and then we are also going to request additional help. So because this is an injury to the chest, we don't need to stabilize the neck or the spine. Our first general impressions of the patient is that he is a young man sitting in the dugout in moderate to severe respiratory distress. He is relatively responsive and he answers questions appropriately. The only thing is that obviously he has shortness of breath and he's having pain in his chest. The chief complaint, pain in the left side of the chest and shortness of breath. In this particular scenario, the airway is open and patent, so we don't need to do anything to secure the airway. He is having 24 breaths per minute and shallow and diminished lung sounds on the left side. So this is an indicator that he could have a lung issue on the left side. Upon assessment, there is no major bleeding. He has a rapid radial pulse, which is strong and equal, and his skin color is warm pink and diaphoretic. So he's got blood flow. Taking a sample history, the injury, his symptoms are acute onset of left-sided chest pain and shortness of breath. Allergies include penicillin. He's on no medications. The patient has had no previous medical history. The last meal he has eaten was dinner 2 hours ago, and the mechanism of injury was he was struck in the left chest with a baseball. Upon a head assessment, we see no injuries noted. This includes inspection of the mouth, nose, and assess the facial area. Again, the injury was to the left side of his chest, so we don't have to worry about any spinal, neck, or facial injuries. Alright. So upon assessment of the chest, we do see bruising and tenderness over the left ribs. Breath sounds are diminished on the left side. There's no injury to the abdomen or the lower or upper extremity. And then no injuries to the posterior thorax, lumbar, buttocks, rest of the area. And there's proper blood flow in all areas. Alright, so his first set of vitals, we have a blood pressure of 95/60. We have a pulse of 122 beats per minute. Respirations are 24 breaths per minute and are shallow. His O2 saturation is 95%. So we have a pretty low blood pressure and a very high pulse rate. This could be due to pain, also nerves. His breath rate is low due to the fact that he can't breathe. And we do not have any secondary injuries. So upon our second assessment, his heart seems to be doing fine. So the main thing that we want to worry about is his lung function in the left lung. So we want to see if he has any injuries there. So I would suggest that we put him on some oxygen to give him a little bit more oxygen, help him breathe a little bit more. Keep taking vitals, make sure that his heart is doing good, his blood pressure doesn't drop or elevate. See if we can get him calm down a little bit to get that heart rate down, and then I would suggest taking them to the hospital so he can get some x-rays of his ribs. It is most likely what I would say probably broken